Hello, Portugal. Hello, colleagues throughout the world that are joining us in the first Portuguese Society of Integrative Medicine Conference. We have to do it virtually this year. And I'd like to thank my colleague and friend, Dr. Ana Moreira, for all the work she has done in founding this society and putting this conference together. So thank you for the invitation. Today, we're going to speak about the intelligence of cancer. When we speak about the intelligence of cancer, we now in 2020, we know a lot about cancer. And so let's discuss that today. But before that, just for you to know a little bit about myself, I'm the founder and chief medical officer of Hope for Cancer Treatment Centers. I have more than 30 years of experience as an integrative cancer physician, licensed in Mexico and Spain. And recently, I've been the author of Hope for Cancer, 7 Principles to Remove Fear and Empower Your Healing Journey. The development of these 7 key principles of cancer therapy is so important because 6 of these principles apply to all of us. One of them, the non-toxic cancer therapy, is to those of you with cancer. So as you see this presentation today, we're talking about decreasing our risk of cancer. We're talking about cancer treatments. And if you are doing chemo or radiation or have done that recently in surgery, now it's the time to jump on board with the 7 principles of cancer therapy. I'm affiliated with many associations around the world, and I've traveled to 70 countries looking for the best of the best. And I hope that today I could impart some of this information with you. As a facility, as a treatment centers, we established Hope for Cancer Center in Tijuana, Mexico, 20 years ago. So we're celebrating our 20th anniversary this year. And the Cancun facility was established in 2015. And that's where I am now. I'm not sure if you can see behind me, this is the beautiful lagoon in Cancun. And then we have the ocean on the other side. Our treatment centers in Tijuana and Cancun are slightly different. The Tijuana is an accredited hospital in Mexico with over 20 patient rooms where patients come and stay for 3 weeks or more and receive inpatient therapy. The Cancun facility is an outpatient treatment center where patients that are more stable, don't require 24/7 medical care, come to Cancun. And so we have both options depending on where the patient's coming from and also their state of disease. We have received endorsements and established profound relationships with centers and also organizations such as the American College for the Advancement of Medicine, the Cancer Control Society in the US, the Truth About Cancer, and others. And now I'm so happy to be part of the Portuguese Society of Integrative Medicine. So in today's talk, we're going to mention the 10 biological hallmarks of cancer. These are 10 characteristics that are inherent to all cancer types. So it doesn't matter if it's prostate cancer, breast cancer, pancreatic cancer, colon cancer. These characteristics are at the root of cancer development, cancer progression, and or metastasis. We're going to see the difference between smart cancers and stupid cancers. Thirdly, the need. Why do we need an integrative treatment approach when dealing with an oncological patient? We'll talk a bit about that cancer biological terrain. What is that tumor microenvironment that makes the cancer more susceptible to grow in that particular organ and or tissue? We'll describe quickly the 7 principles of cancer therapy, and then we'll have a breast cancer survivor story that's kind of illustrative of a patient who was diagnosed with cancer. She did conventional therapy, integrated some things, and then after being fine for a number of years, had a recurrence. Why does that happen? So after decades and of research, billions of dollars spent on chemotherapy, surgery, and now more recently immunotherapy and targeted therapies in combination with radiation, we see that there really is no silver bullet against cancer. These therapies are failing us. The survival, 5-year survival has not increased, have not improved in the last 10, 20, 30 years. And why is this so? We go back to the works of Dr. Weinberg and Dr. Hanahan back in 2000, where they developed the hallmarks of cancer. At this time, there were 6 of them. And the next generation, which was revisited in 2011, they established 4 more hallmarks of cancer. So presently, we have what we call the 10 hallmarks of cancer as developed by these 2 brilliant scientists and researchers. I had the opportunity to meet Dr. Weinberg at work that we've done at Harvard University in the US, and it was one of the highlights of my career as an integrative oncologist. So when we talk about these hallmarks of cancer, this is one of the 2 people that have worked tirelessly, day after day and night, to develop and research and find these hallmarks of cancer. So here you see the 10 hallmarks of cancer, and we'll go into each one by one or 2 by 2 so that we could understand that how important these hallmarks are and truly the intelligence of cancer. So the first 2 hallmarks is that cancer cells are able to evade growth suppressor signals from your body, like the P53, right, which is going to suppress cancer cells and viruses, but cancer cells suppress these growth suppressor signals and evade them. Also, cancer cells are able to sustain proliferating signaling. And so this is unique because it's the intelligence of cancer and their ability to bypass these inherent mechanisms that the body has to protect themselves against cancer. And here we see a bit more detail on how we're able to evade, or cancer cells are able to evade growth suppressor signal. This is a situation of a normal cell where there's no stress or mild reversible change